The most outstanding Chinese medicine for cancer treatment, Professor Chen Hailin. Cancer is a world-class problem. When it comes to cancer, the first thing that comes to mind is death. Cancer is known as a world-class medical problem because of its drug resistance, easy metastasis, and easy recurrence. Throughout the ages, medical scientists have never stopped researching cancer, but they have never been successful. It is not uncommon for people who study cancer to die from cancer. Western medicine is the mainstream of anti-cancer, but Chinese medicine handed down from the Chinese ancestors should not be underestimated. Therefore, there are many Chinese medicine practitioners who do not care about fame and wealth, and treat low-key people in a low-key manner. And Chinese medicine Professor Chen Hailin is one of them. In recent years, the morbidity and mortality of tumors are on the rise worldwide, and the mortality of malignant tumors has become the first cause of death for residents worldwide. Cancer is a disease that is difficult to treat at the current medical level. The reason is that the cancer does not have any symptoms in the early stages, and most patients are found at an advanced stage. Once many patients suffer from tumors, they feel that, and quote, the sky is falling, and quote, life is hopeless, and quote. The appearance of Chen Hailin brought hope to the majority of cancer patients. In more than 10 years of medical career, Professor Chen Hailin has always adhered to the road of fighting cancer with traditional Chinese medicine. For thousands of years, Chinese medicine has been closely related to the reproduction of the Chinese nation. It is not only an outstanding advantage of the Chinese nation, but also a treasure of world medical culture. In order to promote the development of traditional Chinese medicine, it demonstrates the dual strength of Chinese culture and technology, and also enhances people and APO's recognition of excellent traditional culture. Feel. And quote, Chinese medicine is the quintessence of the country and the treasure of the Chinese nation. It is a glorious mission and a great responsibility to develop Chinese medicine. It has a good reputation in the eyes of patients. It is the belief in life that it has cured patients all over the country and defeated various cancers. The support and progress of Chen Hailin all the time, no matter how the stages and occasions of life change, this belief is always the same. Over the past 30 years, Chen Hailin has treated thousands of cancer patients, many of whom are poor and cannot see a doctor. Nevertheless, Chen Hailin did not give up on them. Sometimes he preferred to treat poor patients at his own expense. Wang Mao and APO's, female, 74 years old, from Chengzhi City, Shaanxi Province, with stage 4 pancreatic cancer. In order to ensure the authenticity of the report, the editor personally dialed the phone number of Wang Mao and APO's, family to learn more about the patient and APO's situation. It is understood that Wang Mao and APO's, and Professor Chen Hailin are in the same village. According to Wang Mao and APO's, family, Professor Chen and APO's medical skills are quite famous in the local area, and many patients from other places come to see Professor Chen Hailin for consultation. When asked why Ms. Wang and APO's family did not choose Western medicine for treatment during the return visit, the family said, "The old man has always been in poor health. And pancreatic cancer is advanced, the hospital has given up treatment." As a family member, seeing the patient being tortured by the disease every day felt distressed and couldn't and APO's stand it. Western medicine gave up treatment, but the family was unwilling to give up. After getting to know Professor Chen Hailin deeply, they resolutely chose Chinese medicine treatment. At first, she also had the attitude of trying. At present, Ms. Wang has been taking the traditional Chinese medicine prescribed by Professor Chen Hailin for more than 2 months. She was unable to walk on the ground before, but now she can move normally. The disease is under control and the body is improving step by step. The family is very glad that they did not give up the treatment of their mother. Choosing Chinese medicine is the most correct choice. I am very confident that I will recover under the treatment of Professor Chen Hailin. Chinese medicine is the quintessential culture of the Chinese nation. Professor Chen Hailin upholds his own heart, forges ahead, and devotes most of his life to Chinese medicine. Professor Chen Hailin and Apo's medical skills are superb, and he is a leader in the field of Chinese medicine for mankind. I believe that more and more patients will recover under the treatment of Professor Chen Hailin. Yang Ban and Apos, male, 70 years old, chef, from Linchuan County, Shaanxi Province. Carcinoma of gastric cardia. Pain in epigastric cavity due to difficulty swallowing. 4 features on December 2000. The third diagnosis was in the second inflammation. Gastric body cancer could not be ruled out. Immediately, he rushed to Henan Linju People and Apos hospital to prepare for surgery. After a comprehensive examination at the hospital, due to his old age and frailty, the hospital suggested conservative treatment, mainly taking medicine. After nearly 2 months of observation and treatment, the condition gradually began to deteriorate from a semi-liquid diet to a full fluid diet, and eventually led to no water intake, and it was hopeless to see Western medicine. On March 17, 2001, the patient was accompanied by his children and came to see a doctor. Treat: sticky phlegm persists, dry stool, dark purple tongue with thin white fur, moist and stringy pulse, with a history of cerebral infarction. After being diagnosed by Professor Chen Hailin, the patient started a prescription. The patient took traditional Chinese medicine for 5 months. In August 2001, no disease was found in the hospital. The body recovered completely. So far, there has been no recurrence or metastasis in 21 years. Case 43, left upper lobe lung cancer, with mediastinal lymph node metastasis, compression of ascending aorta, compression of descending aorta. Yang Shanhu, male, 38 years old, was from Chengzhi City, Shaanxi Province. Left upper lobe lung cancer, with mediastinal lymph node metastasis, first visit, May 1, 1998. Chief complaint: the patient had a cold from early April 1998 and caused cough and low fever. Weak. When it was difficult, on April 29, 1998, Chengzhi Hospital of Traditional Chinese Medicine performed a CT examination, CT number 0851. Contrast scan of the T department, the left upper lobe of the left lung can be seen as a round mass shadow, the left main bronchus and main trachea are compressed, and the main air duct is positioned to the right. The size of a quasi-circular and irregular lobulated soft tissue mass can be seen in the front part of the left upper lobe of the left lung. The main trachea is compressed and narrowed, the main trachea shifts to the right, and the left posterior chest wall has a crescent-shaped watery density. Diagnosis: A1, Ca in the left upper lobe lung with mediastinal lymph node metastasis. 2. Invasion of descending aorta and pulmonary aorta. The hospital suggested the chance of surgery has been lost. Radiotherapy and chemotherapy can be done, and the patient himself is willing to take traditional Chinese medicine. Treat. Come to see a doctor before May 1, 1998. Syndrome: tall and thin body, bloated complexion, chest tightness, shortness of breath, back pain, cough, shortness of breath, dry mouth and throat. Red tongue with little moss, stringy and thready pulse, with a history of alcohol and tobacco addiction. Syndrome: differentiation, deficiency of both qi and yin, exuberance of piezotoxic plastic, loss of body fluid. Method for the treatment of heat clearing and stasis dispelling, stagnation dispelling and swelling reducing, replenishing body fluid, nourishing qi and nourishing yin. After 32 days, taking 16 pairs of traditional Chinese medicines, the patient and APO's self-symptoms were good. I asked for a review, and on June 4, 1998, Chengzhou City Second People and APO's Hospital fiber optic bronchoscopy inspection, numbering 98,957 inspection findings, total trachea, smooth, carina, sharp, right main bronchus, upper lobe, middle lobe, and lower, each bronchus of the right lung and each lobe lung segment, the mucous membrane is smooth, and the opening is normal. Left main bronchus, upper lobe, lingual lobe, lower lobe, the openings of each bronchus and lung segment of the left lung are normal and smooth, and no space-occupying lesions are seen. Microscopic examination diagnosis: no space-occupying lesions were seen in both lungs. After 32 days of careful treatment, the patient and APO's lung symptoms disappeared completely. After clinical cure, he felt happy and strong, and went to work again. Chen Hailin, male, 58 years old, was an employee of the Luqing Post Office in Shaanxi Province. Meningioma, recurrence after cholesteatoma surgery. The patient was diagnosed with meningioma, recurrence after cholesteatoma surgery, in a hospital in Luoyang, Henan Province on May 16, 1995. He has been treated with Western medicine, but the condition has not improved much with conservative treatment. In 1999, I found out that Professor Chen Hailin came to see the doctor. Professor Chen Hailin investigated the patient's condition and prescribed Chinese medicine suitable for the disease. The patient took it for half a year. A kind of circular T and W low signal was seen in the left cerebellopontine peduncle, and the T2 high signal was about 3 by 3.1 in size. Thick. Diagnosis: consider benign cystic space-occupying lesions in the left cerebellopontine foot area. Dermoid cysts are more likely than arachnoid cysts, and bilateral maxillary sinusitis. Immediately, he was transferred to Beijing Qiantan Hospital, Zhuanwu Hospital, and many other hospitals. The opinions of experts were unanimous, and the possibility of performing the second brain tumor operation was not very certain. Accompanied by relatives, the patient visited several hospitals and finally chose a hospital specially made Huolu pills and brought them back for long-term treatment. During the treatment, he suddenly felt numbness, soreness, swelling in his left leg, urinary incontinence, dry stool, nightmares, insomnia, crooked eyes and other symptoms. The patient was thin, with a bitter complexion, splitting headache, numbness in the left hemisphere, hearing loss in the left ear, blurred vision in the left eye, cold, sore gums, nightmares, insomnia, stiffness in the left side of the body, urinary incontinence, dry stool, decreased appetite, red tongue, sticky and thickened fur, deep and stringy pulse. There is a history of hypertension and blood sugar. Dialectical, liver-young hyperactivity, spleen dysfunction, stases, phlegm damp obstructing collaterals. Method for the treatment of calming the liver and purging fire, promoting dampness and resolving phlegm, dissipating stagnation and blood stases, promoting clearness and reducing turbidity. Follow the above, guard the pathogenesis, and observe closely. After 2 months of careful care and treatment, the patient and APO's symptoms improved, the headache was lighter, the vision in the left eye was clearer, the urination resumed, and the stool went smoothly, but other symptoms still existed. In order to consolidate the course of treatment, Chinese medicine treatment was continued. After another 2 months of treatment, the patient sleeps basically normally at night, rarely has nightmares, insomnia disappears, eyesight has improved, hearing has improved slightly, left leg can walk freely and conveniently, and numbness on the left face is basically normal, but the gums are still cold, sore, and swollen. 1. MRI findings. The left pontine and cerebellar peduncle showed TIT2 signal, the signal was uneven, the left brainstem was slightly compressed, and the fourth ventricle was slightly shifted to the right. Compared in May 1998, there was no obvious change. In addition, the ventricle was not large, and the cerebral artery flow was normal. There is a CPA space-occupying lesion on the left side of the image, and an enhanced scan is recommended. Reviewed by neurologists, compared with the original film, the left cerebellopontine footprint is significantly smaller. Treatment opinion: continue to treat with traditional Chinese medicine. In order to consolidate the treatment effect, I made appropriate adjustments on the basis of the previous ones and continued to take it for about half a year. After nearly a year of traditional Chinese medicine treatment, the above symptoms all disappeared, the patient moved freely, lived a comfortable life, and often exercised outdoors. In addition, I have 4 acres of land, and I have been continuously participating in agricultural labor and housework for 12 years. From June 14, 1999 to May 3, 2000, During the 13 years, he was cured at one time, and no recurrence or metastasis was found. After many follow-up visits, he was in good health and continued to participate in labor. Liu Haixu, male, 57 years old, was a construction worker from Chengzhi City, Shaanxi Province. Lung cancer, multiple nodules in the upper lobes of both lungs and the lower lobe of the left lung, except for multiple nodules that turn dry. The patient was at a high-altitude construction site and suddenly experienced chest tightness, dyspnea, coughing, and bloody sputum. Immediately rushed to the nearest Shaanxi Coal Hospital. CT examination, scattered in both lungs and mostly scattered in occult nodular metastases. The hospital suggested, go back to Chengzhi Hospital, hometown hospital, for radiotherapy and chemotherapy. August 14, 2009 Spiral CT examination report of Chengzhi People and Apo's Hospital, scattered multiple occult nodules can be seen in bilateral lung fields, with rough edges, the largest being about 15 mm. After checking out, the director of the radiology department of the hospital and the patient were from the same village. He also informed the family members of the immediate and fast treatment, and the family members asked how long it would take to heal. The doctor put in chemotherapy for up to 8 months. The family members asked again, after 8 months. The doctor said, people usually leave after not persisting for such a long time. Later, I went to other places to inquire about the hospitalization and treatment, and it dragged on for another 2 months, and the feedback basically coincided with the same. On November 18, 2009, the CT scan report of Heping Hospital affiliated to Chengzhi Medical College, imaging diagnosis, 1. Multiple nodules in the upper lobe of both lungs and the lower lobe of the left lung, and metastasis is not excluded. 2. Thickening of the left pleura. 3. Enlarged mediastinal lymph nodes. The patient came to the doctor for treatment on November 18, 2009, emaciation, cough, bloody sputum, distending pain in the chest and ribs, dyspnea, especially paroxysmal at night, sleep, night sweats, gastritis, ulcer type, map-colored tongue with thick and yellow coating, thready and astringent pulse. From September 18, 2009, the interventional treatment of pure traditional Chinese medicine began. After 7 months of clinical observation, after taking it, I felt good. I checked in a local hospital, it has improved compared to before. At this time, the patient had stopped taking the drug and began to return to his old job in Murakami. Until November 3, 2010, CT diagnosis report in Hejia Hospital affiliated to Chengzhi Medical College, 13 years since the examination on November 3, 2010, no examination has been done. He is in good health and will continue to work. He will be followed up during the Spring Festival in 2022. He is in good health and will continue to work in construction. I sincerely wish him health, happiness and peace. Wang Yong, male, 28 years old, is from Makhang village in the suburbs of Chengzhi City. On January 4, 2015, he underwent the first bladder cancer operation in Chengzhi Hejia Hospital. The operation continued to recur. On May 15, 2015, he underwent the second bladder cancer operation in Shanxi Cancer Hospital. After the operation, the recurrence continued. On June 23, 2015, he underwent ultrasound examination at the Third People's Hospital of Chengzhi City. The bladder filling was not good. The right posterior wall of the bladder seems to have 18 mm*, 10 mm middle and low four-tone papillary protrusions. On June 24, 2015, I came for Chinese medicine treatment. After 2 months of treatment, a cystoscopy was performed in Shanxi Cancer Hospital on August 19, 2015. The cancer disappeared, and there was still hyperemia, redness and rough mucosa in the trigone. After the examination results, I continued to work. So far, 7 years have passed and the disease has been cleared at one time. No recurrence or transfer has been seen. I wish him good health, happiness, and take care. Looking back on the past few decades, Professor Chen Hailin has experienced too much in the difficult years. One-sentence summary: 99 points of sweat, 1 point of inspiration, more than 40 years to achieve leapfrogging. Professor Chen Hailin expanded the space for thinking and imagination from multiple levels, systems, directions, dimensions, and channels. Combine traditional culture and Book of Changes and 5 elements and with Qigong, yin and yang, and self-cultivation. Under the guidance of the theory of multidimensional addition of triple burner gasification in traditional Chinese medicine, it is organically combined with modern medical diagnostic methods and imaging data. Prepare symptomatic drugs, perform gasification, intervene in the gasification center, spleen and stomach in the human body, perform upper and lower gasification mechanism, enter the lesion, quickly curb the proliferation and metastasis of cancer cells, directly kill mutant cancer cells and repair missing mutant cells and cytoplasm, reversing cancer cells into normal physiological cells. Theoretical basis and Qian Yuan Gda Lun says, heaven is gas, earth is shape and gas are interconnected and transformed into all things. Therefore, the understanding of human physiology and pathophysiology in internal classics is completely from the perspective of transformation of gas come to understand, from the perspective of gasification to study physiological phenomena, pathological phenomena, disease diagnosis, treatment. The preventive principle of the human body, through the evolution of gasification, can quickly achieve the goal of eradicating tumors. Using all specimens, a comprehensive cancer treatment plan with unique characteristics and innovative thinking of traditional Chinese medicine has been created.